Hello everyone, welcome back to our channel. In this video we will see the important genetics topics Prader-Willi, Edward and Patau syndromes. In this slide we are seeing the important features of the Prader-Willi syndrome. Main defect is the hypothalamic dysfunction that causes to the other abnormalities. First we will see the genetic basis of Prader-Willi, then we will move on to the clinical features. Now we will see the genetic basis of Prader-Willi syndrome. It is caused by the loss of parental gene expression in the region 15q11, q13. It is a typical example of the microdeletion on the paternal chromosome, and it's also an example of genomic imprinting disorder. I hope you know the terms microdeletion. Microdeletion involves deletion of small fragment of chromosome, usually less than 5 million base pairs, and this syndrome is an example for the microdeletion, and it's also an example for genomic imprinting. Can anyone tell? Have you heard in the previous genetic classes genomic imprinting? Yes, genomic imprinting is a phenomenon that involves the expression of a gene depending upon its maternal or paternal origin. Imparted gene is not expressed, but similar gene, that is the allele, carried from another parent is expressed. And this Prader-Willi syndrome is the typical example for genomic imprinting. Another example is Angelman syndrome. Just now we saw that Prader-Willi syndrome comes under the microdeletion syndrome, and in this slide we are seeing the other examples for the microdeletion syndromes. So we have seen the genetic basis of Prader-Willi syndrome. Now we will see the clinical features of Prader-Willi syndrome. If you see the clinical features, in the neonate hypotonia is present, and in the early childhood the child is having over appetite, and obesity is the characteristic feature in the early childhood. If you see the stature short and intellectual disability, if you see the sexual characteristics, hypogonadism, and even behavioral issues are noted in the Prader-Willi syndrome. Now we are continuing with the clinical features of Prader-Willi syndrome. We can see in this picture typical facial features of Prader-Willi. Almond-shaped eyes, narrow forehead, and you can peculiarly note the thin upper lips. That is one of the identifying feature in the face in the Prader-Willi syndrome. Now we have completed the Prader-Willi syndrome. Prader-Willi syndrome can be diagnosed by the cytogenetic analysis using FISH techniques, and the treatment is mainly supportive. Now we will move on to the next syndrome, Edwards syndrome. Edwards syndrome, Trisomy 18, that is the genetic basis. You all know by this time what is trisomy, presence of an extra chromosome. Here it is 18, so it is the 18th chromosome we are having extra chromosome. So most of the cases of trisomy are due to the non-disjunction during meiosis, and the risk increases with the maternal age. Now we will see the clinical features of Edwards syndrome. The main clinical features are IUGR, intrauterine growth retardation, and if you see the face, low set ears and micrognathia. If you see the upper limb, clenched hands with overlapping fingers. If you see the feet, rocker bottom feet, severe intellectual disability and associated congenital heart defects. Edwards syndrome has high mortality rate within the first year of life. Now we will move on to the next syndrome, Patau syndrome. Patau syndrome is similar like Edward, caused by trisomy. Trisomy in the region 13. That is the genetic basis of Patau syndrome caused by an extra chromosome in 13. And most of the cases of trisomy are due to non-disjunction and occasionally translocation. And this syndrome is also associated with advanced maternal age. Students should note that this Patau syndrome, Edwards syndrome were named after the scientist who first described. This Patau syndrome was first described by Klaus Patau in 1960. Edwards syndrome was first described by the scientist John Edward and in 1960. And you should also note that this Edwards syndrome is the second most common autosomal trisomy, and the first one is the Down syndrome. Now we will continue with the clinical features of Patau syndrome. Most common clinical features are holoprosencephaly, mild microcephaly, small eyes, cleft lip and or palate, clenched fist, prominent heels, and usually associated with the septal defects in the heart, and in the male the testis presents as cryptorchidism. So these are the commonest features in the Patau syndrome. So now we have completed three important genetic syndromes. These three important genetic syndromes are given for you in the competency number AN 45.3, Prader-Willi, Edward and Patau. Prader-Willi is an imprinting defect on the chromosome 15. Edward syndrome is trisomy 18. Patau syndrome is trisomy 13. Clinical features of Prader-Willi mainly obesity and hypotonia. Edward, growth retardation and overlapping fingers. Patau, facial abnormalities mainly and polydactyly. I hope you should have understood these three important genetic syndromes. In the next video, we will see in the next topic. Those who are not subscribed to the channel, do subscribe now. Keep watching the videos. Thank you.